Hi, my name is Adam Brand, and I'm a rising third-year student at the Chicago School in Washington, D.C., where I am working towards completing my PsyD degree. My research, done in conjunction with Zain Ansari, Dr. Elena Morin, Dr. Michael Scherer, Dr. Mariana Sanchez, Dr. Eduardo Romano, focuses on health factors as predictors of depression and anxiety among recent Latinx immigrants in Miami-Dade County, Florida. The purpose of our study is to help find feasible and practical health interventions. Given the high cost of many health interventions, such as therapy, we studied the effects of other less costly interventions on improving depression and anxiety, including interventions aimed at improving sleep, exercise, and diet. With the increase of community-level stressors, such as increased immigration enforcement, on this already vulnerable population, providing research-based evidence that can be easily adopted by recent Latinx immigrants became increasingly pertinent to do. When taking a look at demographics, data for a cross-sectional study was derived from a larger longitudinal prospective cohort study that looks at pre to post immigration alcohol use trajectories among Latino immigrants during their first decade in the US. Some notable inclusion criteria included being 18 to 34 years old at the start of the study, identifying as Latino or Latina, and an intention to stay in the US. Taking a look at the demographic info on the right shows that there are about 493 participants in the study. The study was conducted during the 7th time period, so the mean age at that time was 37 years old. About 10% more individuals identified as male and had a college education or higher, and about 75% of the participants were married or in a relationship. As previously stated, they were in the US, well, they were in the US for about 12 years at this point, as it was conducted in the 7th time period. Participants self-reported health behaviors and mental health concerns, including sleep via the Pittsburgh Sleep Quality Scale, exercise via the National Health and Nutrition Examination Survey, diet via the HBCS Study Scale, anxiety via the GAD-7, and depression via the Center for Epidemiologic Studies Depression Scale. Structural equation modeling was then used to assess the interactions between health behaviors, as well as predictors of anxiety and depression. When taking a look at the major findings, the model demonstrated adequate fit and found that sleep demonstrated a strong relationship with both depression and anxiety. However, diet and exercise were also found to have significant relationships with anxiety and depression. So, the findings of the current study emphasize the need to promote healthy sleep patterns, strive for enough exercise, and maintain a healthy diet to aid in reducing symptoms of anxiety and depression among recent Latinx immigrants to the Miami-Dade County area. In particular, interventions aimed at optimizing sleep to reduce depression may provide the most notable benefits. Future research may use these results to examine how promoting individual-level health variables may buffer against the impact of community-level stressors. In addition, future research may consider how changing guidelines related to health-related behaviors in communities with recent Latinx immigrants may impact their health outcomes. So thank you for your time. I hope you learned something new from this study.